Hello everybody! Today I'm going to talk to you about menopause symptoms. So what exactly is menopause? According to Medicine Plus, U.S. National Library of Medicine, menopause is a time in a woman's life when her period stops. It usually occurs naturally, most often after the age 45. Menopause happens because the woman's ovaries stop producing the hormones estrogen and progesterone. A woman has reached menopause when she has not had a period for 1 year. What are the symptoms? Mayo Clinic mentioned that in the months or years leading up to menopause or perimenopause, you might experience these signs and symptoms: irregular periods, vaginal dryness, hot flashes, chills, night sweats, sleep problems, mood changes, weight gain and slowed metabolism, thinning hair and dry skin, loss of breastfulness. Signs and symptoms include changes in menstruation can vary among women. Most likely, you'll experience some irregularity in your periods before they end. Skipping periods during perimenopause is common and expected. Often, menstrual periods will skip a month and return, or skip several months and then start monthly cycles again for a few months. Periods also tend to happen on shorter cycles, so they are closer together. Despite irregular periods, pregnancy is possible. If you've skipped a period but aren't sure you've started the menopausal transition, consider a pregnancy test. Can we die from menopause? U of M Health Organization mentioned that your risk of heart disease and stroke is higher after menopause. This higher risk is not completely understood, but cholesterol, high blood pressure, and fat around the belly, all things that raise the risk for heart disease and stroke, also increase around this time. Bone thinning or osteoporosis: as you age, your bones get thinner naturally. Bone loss increases around menopause when ovaries stop making estrogen. Estrogen is a hormone that protects against bone loss, so the older you get, the more likely you'll have osteoporosis. But you can help slow bone loss and prevent broken bones with weight-bearing exercise and a diet rich in calcium and vitamin D. Metabolism: as you age, your metabolism naturally slows down, but your metabolism and weight are not out of your control. One way to boost your metabolism is to be more active. When you exercise, your metabolism speeds up. For a few hours afterward, it stays slightly higher. And over time, regular exercise builds muscle. The more muscle you have, the more muscle of a boost your resting metabolism gets. Diabetes: the risk of getting prediabetes and type 2 diabetes increases with age. Your risk may be higher if you are overweight, get little or no exercise, or if you have type 2 diabetes in your family. Thyroid problems: women have the highest risk for hypothyroidism. Some perimenopause-like symptoms may be caused by a thyroid problem. The causes of menopause are revealed by Jean and Hale's organization. Menopause occurs when there has been a change in a woman's reproductive hormones and the ovaries have run out of eggs. Menopause can only happen naturally at the expected age, or prematurely or early. Periods can stop unexpectedly due to primary ovarian insufficiency (POI), or menopause can occur when the ovaries are removed through surgery, called oophorectomy, or because of various treatments for cancer. Natural ways to reduce symptoms of menopause. According to Healthline website, here is a list of some natural ways to reduce symptoms of menopause. Eat foods rich in calcium and vitamin D. Hormonal changes during menopause can cause bones to weaken, increasing the risk of osteoporosis. Calcium and vitamin D are linked to good bone health, so it's important to get enough of these nutrients in your diet. Adequate vitamin D intake in postmenopausal women is also associated with a lower risk of hip fractures due to weak bones. Many foods are calcium-rich, including dairy products like yogurt, milk, and cheese. Green leafy vegetables such as kale, collard greens, and spinach have lots of calcium too. It's also plentiful in tofu, beans, sardines, and other food. Additionally, calcium-fortified foods are also good sources, including certain cereals, fruit juice, or milk alternatives. Sunlight is your main source of vitamin D, since your skin produces it when exposed to the sun. However, as you get older, your skin gets less efficient in making it. Achieve and maintain a healthy weight. It's common to gain weight during menopause. This can be due to a combination of changing hormones, aging, lifestyle, and genetics. Gaining excess body fat, especially around the waist, increases your risk of developing diseases such as heart disease and diabetes. In addition, your body weight may also affect your menopause symptoms. Eat lots of fruits and vegetables. A diet rich in fruits and vegetables can help prevent a number of menopause symptoms. Fruits and vegetables are low in calories and can help you feel full, so they're great for weight loss and weight maintenance. They may also help prevent a number of diseases, including heart disease. This is important since heart disease risks tend to increase after menopause. This could be due to factors such as age, weight gain, or possibly reduced estrogen levels. Finally, fruits and vegetables may also help prevent bone loss. Avoid trigger foods. Certain foods may trigger hot flashes, night sweats, and mood swings. They may even be more likely to trigger you when you eat them at night. Common triggers include caffeine, alcohol, and foods that are sugary or spicy. Keep a symptom diary. If you feel that particular foods trigger your menopause symptoms, try to reduce your consumption or avoid them completely. Exercise regularly. There is currently not enough evidence to confirm whether exercise is effective for treating hot flashes and night sweats. However, there is evidence to support other benefits of regular exercise. These include improved energy and metabolism, healthier joints and bones, decreased stress, and better sleep. For example, one study found that exercising 3 hours per week for 1 year improved physical and mental health and overall quality of life in a group of menopausal women. Regular exercise is also associated with better health and protection against diseases and conditions including cancer, heart disease, stroke, high blood pressure, type 2 diabetes, obesity, and osteoporosis. Eat more food that are high in phytoestrogens. Phytoestrogens are naturally occurring plant compounds that help mimic the effects of estrogen in the body. Therefore, they may help balance hormones. The high intake of phytoestrogens in Asian countries such as Japan is thought to be the reason why menopausal women in these places rarely experience hot flashes. Food rich in phytoestrogens include soybeans, soy products, tofu, tempeh, flax seeds, linseeds, sesame seeds, and beans. However, the phytoestrogen content in food varies depending on processing methods. Drink enough water. During menopause, women often experience dryness. This is likely caused by the decrease in estrogen levels. Drinking 8 to 10 glasses of water a day can help with these symptoms. Drinking water can also reduce the bloating that can occur with hormonal changes. In addition, water can help prevent weight gain and aid in weight loss by helping you feel full and increasing metabolism slightly. Drinking 17 ounces or 500 ml of water 30 minutes before a meal may lead you to consume 13% fewer calories during the meal. Reduce refined sugar and processed foods. A diet high in refined carbs and sugar can cause sharp rises and dips in blood sugar, making you feel tired and irritable. In fact, one study found that diets high in refined carbs may increase the risk of depression in postmenopausal women. Diets high in processed foods may also affect the bone health. A large observational study found that among women aged 50 to 59 years, diets high in processed and snack foods were associated with poor bone quality. Don't skip meals. Eating regular meals may be important when you're going through menopause. Irregular eating may make certain symptoms of menopause worse and may even hinder weight loss efforts. A year-long weight management program for postmenopausal women found that skipping meals was associated with 4.3% less weight loss. Eat protein-rich food. Regularly eating protein throughout the day can help prevent the loss of lean muscle that occurs with age. One study found that consuming protein throughout the day at each meal may slow down muscle loss due to aging. In addition to helping prevent muscle loss, high-protein diets can help with weight loss because they enhance fullness and increase the amount of calories burned. Food rich in protein include meat, fish, eggs, legumes, nuts, and dairy. Take natural supplements. Many women take natural products and remedies to relieve their menopause symptoms. Unfortunately, the evidence behind many of them is weak. What are the most natural supplements for reducing symptoms of menopause? Phytoestrogens. These can be consumed through natural food sources or supplements such as red clover extracts. There is currently not enough evidence to recommend them for alleviating menopause symptoms. Black cohosh. Although some studies found that black cohosh may effectively alleviate hot flashes, the evidence is mixed. In addition, there is a lack of long-term data on the safety of this supplement. Other supplements. Evidence is scarce for the effectiveness of other commonly used supplements such as probiotics, prebiotics, kava, DHEAS, dongchai, and evening primrose oil. Menopause affects sexuality. FPA.org.uk says that as we get older, testosterone levels decline in both men and women, which can affect sexual desire. It's also natural for there to be less blood flow to the clitoris and the vagina, which reduces sensitivity and can make orgasms both more difficult to achieve and less intense. During menopause, the pelvic floor muscle will weaken, and it will continue to do so through the postmenopausal years. This can result in a loss of sexual sensitivity in the vagina. Vaginal dryness is also a common menopausal problem. The reduction and slower production of lubrication in the vagina when a woman is aroused and the thinning and shortening of the vaginal canal means that there is soreness and discomfort during penetrative sex. Hot flashes can also leave you not quite in the mood for sex, especially if sleep is disrupted and if you're feeling really tired. You might find the way you think and feel about things change too. Sexual tastes and desires can shift with time to time in the same way as tastes in other aspects in life, and things that were a turn on in your younger years might not do it for you anymore. But don't panic. There are things you can do to help stay feeling in control of your sexuality and your sex life. Are rashes a symptom of menopause? According to Medical News Today, estrogen plays a vital role in keeping the skin young, elastic, and healthy. Estrogen helps the skin by stimulating the production of oil, collagen, and other substances involved in skin health, promoting wound healing, reducing inflammatory skin disorders during pregnancy or periods of high estrogen, possibly protecting against mortality from melanoma and other skin cancers, providing some protection against sun damage. While decreasing estrogen levels do have an impact on a person's skin, there are many other factors involved in skin health. These factors can include sun exposure or damage, dehydration, smoking, fat redistribution, genetics, and other skin changes like facial hair, thinning skin, and age spots. Food to avoid when you have menopause. Processed food, spicy food, fast food, alcohol, caffeine, and fatty meats. The source is Everyday Health website. Is male menopause real? According to ncbi.nlm.nih.gov studies, male andropause, male climacteric, or viropause is a condition in which men suffer from complex symptomology due to low androgen level with aging. After the age of 40 years, testosterone level starts declining, and andropause corresponds to the age at which pathogenic threshold is reached. This review summarizes the etiology, consequences, screening, diagnosis, monitoring of androgen deficiency in aging male (ADAM). The pros and cons of testosterone replacement therapy or TRT in elderly male have been discussed. Currently, oral, transdermal, transbuccal, intramuscular, and subcutaneous implants are available for clinical use. The choice is made by physicians based on therapeutic indication and patient references. If you have certain information that is not mentioned here, please share it with us in the comments section below.